Just to be honest, I didn't even know this existed at all when I started at the infusion center. And I happened to see a flyer somewhere, somehow, I don't know, I saw a little piece of paper. I'm like, oh, there's a certification for infusion nurses.
One of the jobs I had even required the CRNI for the infectious disease doctors in San Antonio.
I took the test in 1990, and at that time my boss had bought a bunch of VCR tapes that the INS had. So for 2 days prior to the exam, I stayed home and watched these tapes front and back, just took notes, and that's how I prepared.
And my biggest fear about obtaining my CRNI was, what if I don't pass the exam?
Was very much encouraged by other nurses that were CRNIs as well, and just my seeing them being so top-notch in what they would do. How do I get to that point? And as well, they would encourage me, that they saw in me that I have excellent skills, why not validate them?
It has opened up more than a couple of doors, all professional. Have had an opportunity to become a nursing school instructor in the area of IV access, vascular access, in correlation with doing a clinical program for a local college in Louisville.
The last time I changed jobs was about 8 years ago. When I made the job change, I was just getting started on my master's degree. I was very proud of that, and I was surprised when I talked with HR about it that their interest was not so much that I had a master's, but that I was credentialed, because it proved that I knew what I was talking about. I encourage everyone to put that acknowledgement right out there on your name tag, that people recognize just what your knowledge base is, and I think that credential really shows it.
It's a hard exam, don't get me wrong. It needs to be difficult though, because they're trying to make sure that we're knowledgeable, because we're kind of like the cream of the crop in the infusion world, and they want to test our knowledge.
If you are in the field of infusion and you really like it and you're good at it and everything, it is a no-brainer for you to get the certification. I would say get it, find a way to do it. There are so many resources at the INS, the Infusion Nursing Society. Ask your colleagues and validate what you know, validate your expertise.
You don't do it because you have to for a job. I had to for my job, but that shouldn't be your impetus. You should want to do it, not just for your patients, which that's self-explanatory, but for yourself. Because truly, the people out there doing this work are the experts. Obtaining and maintaining your CRNI is really the way to show that to your employer, your patients, your colleagues, that you really are the resource person, you really are the expert.
The biggest thing, the biggest payoff for what we do, we save patients' lives one vein at a time.